All right, we got a couple attendees coming in here. Welcome everyone to the TheraPsil webinar on medical psilocybin legalization in Canada. So today's webinar is being recorded so that for anyone who isn't able to make it, they're able to watch it online later. But let's start off with a couple housekeeping procedures. If everyone looks down in the bottom, you'll see two things. The first is the chat. The second is the Q&A. Looks like we may have a small crowd today, which is great. Keep it a bit more intimate, and hopefully we can answer some questions throughout the webinar. So if you want to chat, perhaps you want to say where you're calling in from today, feel free to put that in the chat box. However, if you'd like to ask some questions, and if you want to ensure that we get to those questions, toss it in the Q&A. And it would be really great to be able to answer both the questions that we've had sent already before this webinar, and also get to the ones as they come up in the chat. So we'll try and get those. Awesome. And from San Francisco Bay Area, welcome. Awesome. So yeah, welcome to today's webinar again on the legalization of medical psilocybin in Canada. Welcome from San Francisco, and from anyone else, if you want to say where you are, that'd be great. Today I'm calling in from Victoria, and I do want to acknowledge that TheraPsil was founded and we operate in Victoria. And the Zoom today is being conducted from Victoria, and this is the traditional, ancestral, and unceded territory of the Songhees, Esquimalt, and Saanich people. So I'd like to honor that. Furthermore, I'd like to honor the fact that the psilocybin that we're talking about today, it wouldn't be here without the knowledge holders and folks who have used this in Indigenous tradition for hundreds, if not thousands of years. So thank you for the creation of it. And we hope to honor you as we continue to support and advocate for it in the 21st century. So here's a quick agenda. First, we're going to go through introductions, and in fact, we can just do that really quickly right now. Myself, I'm Spencer Hawkswell, the CEO at TheraPsil and a patient rights advocate. Call me he, him. And Julia, if I can just pass it over to you quick to introduce yourself.
Sure. Hi, I'm Julia with pronouns she, her, and I'm the research director at TheraPsil, and I've been helping to work with these regulations and collect all the feedback we've had from draft one. And over to Holly.
Sorry, having trouble unmuting. Hi, everyone. Nice to meet you. I am Holly. I am the communications director here at TheraPsil. Pronouns are she, her, hers, and I'll pass it back to Spencer for the rest of the agenda.
Thank you very much, Holly. All right, so we're going to go through a quick agenda. So we'll talk about who TheraPsil is, as hopefully we've got a couple of new folks on the call. And we've recently been working on expanding our audience a bit across Canada too. So I'm hoping that this recording and in this webinar, we're able to see a ton of new faces. I already see a bunch of names that I don't yet recognize, and I always careful to take a look at who's attending. So it's nice to see you. After that, we'll give a little update on TheraPsil, so what's happened over the past couple months and where we're heading, as there are some super important updates as we come into this time after an election with the new health minister. It's going to be major, and we want to let you all know what's going on and what needs to happen in the next couple of months. Finally, we will get to the regulations discussion, and we'll talk about our regulations. I always like to keep at the very top of what we're focused on is those regulations. That is the solution to many of the problems that we're having today, and that we've been having for the last couple of months with Section 56s and people's inability to access psilocybin, both compassionately and through research and for medical treatment. We've also got some pre-submitted questions, so we'll go through those. And then, of course, questions from the audience. And again, if at any point you want to ask a question, throw it in Q&A. Holly, if you think it's important and it's about what we're doing, feel free to interrupt me, and we'll just get to it as they come. It's my favorite way to do these webinars. After that, we'll talk about ways to support, as this is it really is a healthcare coalition, and we need help from everyone who thinks that this is an important issue. This is the way we make political change in this country, is many people lifting a tide, it rises all boats, and quite frankly, we need everyone's help in order to help the patients who right now really need access to psilocybin. So other than that, we'll talk about our next webinar, but without further ado, let's get started. So I'll give a quick introduction about who TheraPsil is. So We are a nonprofit coalition of healthcare professionals, patients, and advocates, and we're based in BC, Victoria. We were started in about 2019. Our founder, Bruce Tobin, who unfortunately couldn't make it on this call today, first realized that patients in Canada who had access to medical assistance in dying and were asking for access to psilocybin weren't getting it. And that posed a special and an ethical dilemma on the part of him as a healthcare professional, but also on our justice system. Why might patients have the right to die, but not the right to try psilocybin? And so together with a couple of other clinicians and Bruce, myself, and the members of this team, we decided to create TheraPsil to work for the patients and healthcare practitioners who need their therapeutic psilocybin in their medical practice. We decided to put it together with four simple but very important pillars to create our mission. And we believe that putting those pillars together would create the foundation for proper clinical access to psilocybin in Canada. And those four pillars, the first is compassionate access. And I really want to accentuate compassion. It is compassionate access it is compassion that got the first couple of patients, about 68 of them now, but back in August of 2020, the original four, access to psilocybin. And it's compassion that today we're seeking for the patients who need access to psilocybin. The second is public education. And we believe that if psilocybin is being made available to patients in Canada, that it's responsibility, the opposite side of the right being the responsibility for us to make sure that we're educating patients, healthcare professionals, and the public about the merits and limitations of psilocybin. We also wanted to make sure that we professionally train the healthcare practitioners who would be delivering this to patients. And I think as of today, we've got a training program running. We've got 19 healthcare practitioners access to psilocybin, with hundreds of others waiting for access. And we were able to launch, I think, the first couple cohorts of training. So we've actually completed quite a few trainings, and that's great because now we've got healthcare practitioners able to support the patients who are getting access to psilocybin. However, of course, there's still a deficit of healthcare practitioners able to give these patients the support that they need. So we'll talk more a bit about that. And finally, research. I think it goes without saying that as you're changing new policies, trying to get people access to anything, let alone medical substances, that making sure that you're reviewing what's going on, creating registers, observing what's happening, that you create that research as a way to share that information with other healthcare practitioners and the public and policymakers. So what we want to do is we want to help patients by getting them legal access to psilocybin and psilocybin therapy through Section 56. However, what's become abundantly clear over the last 2 years of our advocacy is that Section 56 is no longer working. For those who are new, Section 56 is essentially a part of our Canadian drug laws that says that the Minister of Health, who at this point in time it's Patty Hajdu, but we may see a new cabinet minister, a new Minister of Health in the next couple of weeks. Hopefully, Patty Hajdu stays our health minister, but it would allow that health minister to grant any person or class of persons in Canada access to any of these substances within the Controlled Drugs and Substances Act. So in the past, Section 56 has been used to help cancer patients get access to different cancer drugs. It has also been used to grant legal access to ayahuasca for the Santo Daime Church, who are currently using ayahuasca with the active compound being DMT in their religious practice as their sacrament. And what we've been asking is that patients who are at the end of their life, who have the right to die with medical assistance in dying, and we've since expanded that to patients who have treatment-resistant depression, cluster headaches, or anxiety, depression, the list would go on, that any of these Canadians who have tried every other therapy for which there are no other options might get access to psilocybin through this special clause. However, unfortunately, there have been patients and healthcare practitioners waiting over 200 days. And this is unacceptable. It's unacceptable because some of those patients have unfortunately passed away waiting for access, and others have been suffering while their fellow countrymen have been able to enjoy the many benefits that have come along with their access to psilocybin. And so we now advocate for safe, for equal, and predictable access to psilocybin through regulations that put the power to grant psilocybin not in the hands of a bureaucrat or a politician, but in the hands of a doctor, much like our legal cannabis system here in Canada. So we're going to talk more about those regulations, but let's jump to the next slide to give a bit of an update. I realize I've been providing a bit of an update here, but as of today, 39 patients in Canada have received Section 56 exemptions. I believe about 7 of them are non-palliative, and the rest have received it for their use in palliative care. And what we've seen anecdotally is fantastic results from those who have been using psilocybin to get over and deal with their end-of-life distress, which is the combination of anxiety, depression, demoralization. And I think what's important to note here is for the patients who have received it that are non-palliative, their cancer has gone into remission. It's gone away for now, but they still have that same end-of-life distress. And I think it's important to make a distinction that there are 2 classes, if you will, of patients, not that I choose to classify them, but that it seems like the government seems to be currently focusing on only the palliative patients. Meanwhile, there are hundreds, if not thousands, of other patients and healthcare practitioners who are on a wait list, who don't have a palliative diagnosis, but are equally deserving of access to psilocybin. Now, as I had also mentioned before, we've got a training program with 19 healthcare practitioners who have also gotten the approval to use psilocybin for training. But unfortunately, there are hundreds, if not thousands, on a wait list that are waiting for that same access so that they can train with psilocybin, so that they can provide the therapy to their patients. And the unfortunate thing is, again, for about 200 days, we haven't had a healthcare practitioner granted a Section 56 exemption. However, at the same time, patients have been granted exemptions, and this is causing a bit of a discrepancy in the number of qualified healthcare practitioners there are to treat the patients who are getting Section 56 access to psilocybin. So it's quite a big problem. And we believe that the solution here would be taking it and this decision out of the hands of an office that may be slow, tied up with other healthcare concerns, and instead making regulations where patients and doctors don't have to wait hundreds of days that they can't afford, especially for those working in palliative care. We also have a number of patients involved in legal proceedings at the moment. And what we're trying to ask for is a response to the Section 56 in the form of what's called a mandamus application. So we've put together a mandamus request, and essentially it is trying to compel the government to make a decision. And what we are trying to assert is that Section 56 was not created to be ignored and for patients to wait over 200 days, but it was created for the Minister and/or Health Canada to respond in a reasonable amount of time. So we are seeking a response to the exemption, as it seems like there have been no no's. There hasn't been anyone who's been denied Section 56 access. The only thing that's happened is patients have been left waiting, and that's unacceptable in this country. So today's topic is advocating for those regulations, advocating for the solution to these many problems. As I had mentioned before, we have a new health minister, or we will hear that Patty Hajdu will continue to be the Minister of Health after our last election. And what we've been doing is putting together videos of patients, healthcare practitioners, and family members who have been seeking a response from Patty Hajdu and the Prime Minister. And what we're trying to do is put a certain amount of pressure on our government to respond to these patients and doctors who are in critical need of psilocybin, and an urgent need as well. So today we've got about 76 healthcare practitioners waiting for exemptions. And I'm not exactly sure the number of patients. I know it's about over 20 that are waiting for responses to their exemptions as well. We've also got tons of training cohorts that are ready to train, but again, thousands of healthcare practitioners on a waiting list, waiting to hear back from the government so that they can start their training, so that they may be able to support the thousands of Canadians that have reached out to us seeking Section 56 exemptions. Now, something I do want to note here is these numbers do not really do justice to how many people are seeking access to psilocybin. It's unfortunate, but we are a very small organization. And when thousands of healthcare practitioners reach out to us and thousands of patients reach out to us, there's only so much we can do to work with them to put together Section 56s. So again, we are advocating with individuals for a broader group of Canadians who are in need of psilocybin for either their mental, psychological, or physical conditions. Now, I would like to send it over to Julia here. I've been talking too much. So Julia, I'm wondering if you can give us a bit of an update on what's going on with the research that we've got up and running.
Yeah, so TheraPsil is in the process of setting up observational research through international collaboration with researchers from McGill University, Northern Ontario School of Medicine, and also Imperial College London in the UK. And this observational research consists of collecting quantitative data, which is building upon Imperial College's previous groundbreaking studies, their psychedelic surveys they have. And this arm of the observational research is almost ready to launch. And then we're also doing a qualitative arm, which we set up across Canada, which will be sort of understanding the patient and caregiver experience within that community level. And really our hope is that this data collected through this research will just help us to understand this new treatment, improve upon patient experiences, and increase access not only for Canadians who may benefit, but also international community as a whole, and help inform some of these policy changes. And then kind of on top of that, on the side, we've been working with Island Health over here in Victoria to set up surveys for patients who have either been through psychedelic assisted psychotherapy, who've got legal exemptions, or those who are interested in doing so we can gather feedback and sort of understand what other patient-orientated research initiatives we can put forward in the future as well. Yeah.
Awesome. Thank you very much, Julia. Okay, so a quick note on what exactly the access to psilocybin for medical purposes regulations are, short from the APMPR. So in Canada, we're quite lucky, and I noticed that there are some folks here from the US, which is fantastic, and maybe others from elsewhere, this lovely planet. Just in case you didn't know, we do have medical regulations for cannabis in our country, and those were put into effect in the 2000s. And they've been serving Canadians very, very well for the last couple of years. Not that they're perfect, not that they don't have their hiccups, but it's worked. It's created a way for Canadians in medical need of cannabis to get access to that cannabis. And so what we've done to keep things administratively easy for our policymakers and decision makers within the federal health organization within our federal government is we've taken the exact medical cannabis regulations and we've only made a small couple tweaks to make them applicable to psilocybin. And I think that's really important because those medical cannabis regulations did not come about because of a politician or a group of people deciding what would look perfect and just writing it out. It was actually years of litigation. It was lots of back and forth and hard decisions, but nonetheless, those decisions were made. And we believe that if those decisions and the decisions that apply and the situations that apply to cannabis would likely apply to psilocybin as well. Some of those may be that a person that has medical access to psilocybin or a medical cannabis should be able to possess that substance. They should be able to get access to it, not with a bureaucrat or politician, but with their doctor. Their doctor should be the gatekeeper. If possible, they should be able to grow their own. They should be able to do that substance in the safety and comfort of their own home or in a clinic if they choose. And so taking a lot of what was applicable to the medical cannabis regulations, it was really easy to see how well psilocybin fit. So we put together about a 165-page document with all the same 9 parts as our medical cannabis regulations, much of which actually are on the production of that substance, which is very important. We've got to figure out, again, how patients get safe access to psilocybin, how it's packaged, how it's distributed. And we put together about a 165-page document and submitted it to the Federal Minister of Health along with a letter on August 4th, which was the 1-year anniversary since the first 4 Canadians were granted Section 56 access to psilocybin. So our belief is that after an entire year and about 67 exemptions, that it's time to move beyond Section 56 and move to a system that gives more equal access so that any Canadian in need of access gets it, not just the ones that are lucky enough to be at the front of the queue at TheraPsil or at any of the other organizations or healthcare practitioners who are supporting Section 56s, We want to make sure that those patients are also able to get access to a safe substance. It's not widely talked about right now, but if you can believe it, patients are still forced to find their own psilocybin. And even though there is perfectly good GMP certified psilocybin being grown and synthesized in Canada, patients do not have access to it. And that's ridiculous. We deserve better. Patients deserve better. We also want to make sure that it's more predictable and timely. And that's really, really important, again, so that we know that patients are not being discriminated against in any way. And so that a doctor knows whether or not a patient is going to meet the criteria, what those criteria are, and it helps make it a fair and transparent process. It also allows us to understand how long it might take to get that access. As in this country, you can get access to medical assistance in dying in as little as 3 days. Well, we have patients waiting over 200 days to hear back whether or not they may access psilocybin. So these regulations outline how patients can access the legal, regulated medical psilocybin products in Canada. And one thing that we thought was really important is that we put this through a public consultation. So we put it out to the public, asked for any input, any review, and any feedback that might be important and considered, sent out to all of our members, and anyone in Canada who wanted to give feedback could. And we are working on our draft too, with all of that new information and getting ready to send that out to the Minister of Health. What we are looking for is that our Canadian Minister of Health and our government will commit to regulations, if not these regulations that work for our government, by the end of this year, 2021. And that is our goal. So that's the update on where we are with regulations, where things are at with the legal side. And what I'd like to do now is just send it over to Holly to answer a few of the questions. And I think within those questions, we'll be able to flesh out quite a bit more about what's going on. And again, I encourage anyone in the audience here to pop their questions either into the Q&A or even just to chat in the chat. And if you have any comments or anything like that, we'll be able to pick up on them. So Holly, over to you to toss Julie and I some of the questions that have been sent to us.
Awesome, thank you. I think you've already covered this, but if you can wrap it up neat and concise, why do we need regulations for medical psilocybin or psilocybin therapy in Canada?
I think the best response would be that as of today, there are patients that have died trying to get access while they've been waiting, months. And that's unacceptable when those same patients are able to access medical assistance dying in 3 days. I really think it goes back to a compassionate, if Canadians have the right to die in this country, they should have the right to try psilocybin on compassionate grounds. That's even without considering the fact that there's amazing research that shows how effective psilocybin is in treating end-of-life distress. I'd say that the biggest single concern is why are some patients and doctors getting access in 24 hours and why are others forced to wait 200 days? There's no difference in those people. They both stand under the same charter. They are equal in this country. They both have cancer diagnoses or are doctors, and quite frankly, they should be treated the same. We need regulations. It's as simple as that. We can't have anything ad hoc, not something as important as access to medicine.
Absolutely. Thanks, Spencer. So what would the regulations actually regulate? Like what are the 9 parts? What do they stipulate? Maybe Julia, I could toss that to you.
Sure. Yeah. So basically, if this system were to be implemented, then psilocybin products would be manufactured by license holders who would be manufacturing in accordance with standards that have been put in place by these regulations. So the products are either provided directly to the patient or to their healthcare provider. So this is all stipulated within the medical document that we'll maybe get to after. And that product would be clear, and the healthcare providers as well as the patient would understand how much psilocybin is being used and what form it's in as well. So this would be either a dried fruiting body or an edible product, etc. So then the decision of whether or not a particular individual is well suited to receive the psilocybin for therapeutic purposes would be made by the healthcare practitioner, not by administration from the government, who themselves may not actually be familiar with that individual's medical circumstances. And this would in turn then increase the quality and safety and predictability that Spencer mentioned there. So essentially we have license holders who are able to manufacture, and then the system set in place that would allow patients to get access through this medical document with their healthcare providers.
Awesome. Thanks, Julia. Would these regulations also allow for patients to grow their own psilocybin? As I know that's important for a lot of individuals. It's a very therapeutic process for some folks.
Yeah, absolutely. So essentially, I maybe just talk about the medical document that is provided by the healthcare professional. So the kind of the process that a patient would have to go through is first they would go to their either their physician or a nurse practitioner. So this is people who are able to prescribe. However, this is not a prescription, this is a medical document. The physician or nurse practitioner would then assess whether the patient and their medical reasons and ensure that the patient meets all the safety criteria necessary to consume psilocybin. And therefore, if the physician or nurse practitioner deems that the patient is suitable for psilocybin, they will then write this medical document. And this stipulates all of the things that are required for the patient to take psilocybin. So this is all outlined. If you look into our regulations, perhaps we can throw it into the chat at the end of our draft. But in part 9 of there's the medical document can be written, as I said, by the physician or nurse practitioner, and must include what is outlined in the regulations. And this is things like the practitioner name, province, signature, expiration date of this medical document. And then beyond this, they can also include the nature in which individuals must take the psilocybin and where the psilocybin can be delivered to. So for example, with a patient suffering from a cancer-related anxiety and distress, then the medical document may stipulate that the patient may need X amount of grams, maybe only once, 5 to 7. The physician writing the medical document could specify that this must be used in a psychedelic psychotherapy setting, and that they may be notified each time psilocybin is bought. And they can also specify that maybe the psilocybin is either delivered to them or to their treating therapist. However, it doesn't have to stipulate therapy has to take place. For example, with cluster headaches, a lot of these folks have their own kind of regime and schedule for taking psilocybin, and therefore it may just be the amount that this individual requires for the year, and the therapy component may not need to be written into place. So then when the patient has this medical document, the patient can either send their medical document to a sales license holder, who will then send the psilocybin product to where the medical document specifies, or the patient can send this medical document to Health Canada, who will provide a registration certificate that will allow the patient to order starter materials from a sales license holder for patients who want to grow their own produce as well. So it allows for both. It allows for both just accessing psilocybin from a synthetic source, and it also allows patients to grow their own if they're choosing that route as well.
I just ask you a quick question, Julia. It's something that I've seen a couple of times is that there are some people who are worried about, possession, right? Is it safe for some people to possess psilocybin? Is it safe for some people to be able to grow their own? Is it safe for some people to be doing that at home, or should they do it somewhere else? What I'm understanding, I want to make sure that maybe the audience understands it too, as we've said it a few times, but what's been written here is that essentially that's up to the doctor, right? This is that the doctor is able to make those decisions, and that there's a certain amount of sovereignty here for both the patient and the doctor to operate however they would like with the medicine. But again, putting that decision in the doctor's hands, is it fair to say that?
Absolutely. So it's kind of using, our physicians and nurse practitioners as the gatekeeper. So really ensuring that, we're putting in those safety checks, that patients are being heard, that they're going to their doctors who are able to kind of help them along with that process and be involved within it as well. So yeah, really that it's they're getting access through talking with their physicians and nurse practitioners.
Yeah, and I really like that example, that it includes that, as there are people that we've been working with who have been using psilocybin, who have been growing it. It's the only way, and it's worked really well for them. And people that do need to either microdose or macrodose quite regularly and have been doing it alone and have possessed it and been very safe. And of course, there are others who that may not be the best idea for. So having it, having both available, I think is really important. And I always like to remind people that, these regulations and the advocacy is based on how people are currently using it.
Yeah, and I'll just jump in here too. I would say 95%, if not 100% of the individuals we've supported in accessing these exemptions have actually done the psilocybin therapy in their own home or at their therapist's office. And we refer patients out to to therapists trained in psilocybin assisted therapy who have a private practice. So I think it's also important to ensure that patients can do this in the environment that feels best for them. Sometimes that's on their own couch, in their own bed. And I know there's lots of clinics out there, and patients should absolutely have the option to go to a clinic. But for somebody who's living, in a rural area or who may not have the means to access a psychedelic clinic, they should absolutely be able to undergo that therapy in an environment that is, safe and familiar to them. I'm sure everybody here is very familiar with the concepts of set and setting. And so if you're in a new environment doing psilocybin therapy, that might not be the best option for you. So you may want to do it in your own home. And I think having regulations that stipulate that is important. Mm-hmm. Well, you've answered a lot of my questions already, Julia. Maybe we can jump over.
Answer.
Yeah. Go ahead.
I was going to say, perhaps we should answer. It looks like Sarah's asked us a question. Yeah.
Oh, how do doctors liaise with mental health workers, counselors, and psychologists? It's a great question.
Awesome. And I can jump in. I can say that has been perhaps one of the fundamental things we've done here at TheraPsil is, I don't want to say unlike cannabis, because there are many cannabis doctors that will work with other folks, other counselors, healthcare workers. But I think it's especially important with psilocybin access that the doctor understands how the patient is operating, how they're using the substance, along with the mental health worker, because many times it's a combined decision, right, on how this person is going to handle the substance, how they're going to be using it and taking it. So that's exactly part of what we've been working on here, is trying to connect the doctors and the healthcare practitioners in the use of psychedelics. And I think making part of the forms that we have and part of the process to let the doctor know when it's necessary to do that. And my quick example will be, there are some patients who use psilocybin to deal with their chronic pain or cluster headaches. They do not see mental health workers, and nor do they particularly wish to, at least when it comes to the use of their psilocybin. And so for them, there's no need for this liaise with a mental health worker. However, many times that's not the case, and specifically with a lot of the palliative patients that we've seen, and non-palliative ones, we've had to go to quite a few lengths to make sure that the doctor had spoken with and written a letter with that healthcare, with their with the counselor or psychologist. And so that's where we've been trying to help out in this process. And it's where we absolutely make recommendations that any doctor that would be filling out any forms knows when it's appropriate and when it's necessary to connect with a therapist. And so again, part of that process that we have, where doctors get to set the conditions under which a patient is to use psilocybin, many times it may be, this is to be used one time, right? They can set the dose, frequency, and duration, and quite frankly, who it's to be used with and where. And that may be extremely appropriate for many patients. So again, this is being covered in our training, and this is part of the education about the merits and limitations of psilocybin, making it clear that there are some people who are in, states of mind, or maybe even who are able to even go out and possess it. Right? Some patients that we've worked with are completely bedridden, and their therapist is the one who has to bring the psilocybin to them. And that can be done in our regulations. Again, a doctor can write a prescription to other doctors or other healthcare practitioners for access to psilocybin. So making these regulations robust allows for this liaison with the proper mental health care professionals. And it's the primary reason why our training includes all of these folks, is this is a team effort like all healthcare. And we can certainly say that, this may be the crux of many treatments in healthcare at this moment is improper communication between all of the healthcare professionals. So I know as an industry, everyone's working on it, and we certainly are as well.
Just to add to that as well, Spencer, so what we're adding into our draft 2 of the regulations is that a physician or nurse practitioner can also write a medical document for themselves for anyone who requires access for training purposes. So again, it's keeping the onus and the safety and ensuring the vetting process of healthcare professionals who are going to be trained in this modality in order to help patients within the hands of those who can write the medical document as well. And then in terms of, there's been questions as well about, what if something sort of goes wrong? We're also adding in a mechanism for healthcare professionals to be able to revoke a medical document as well within the regulations. And sort of just to expand on that, one of the questions from the FAQs we had from draft 1 is whether the regulation stipulates the regulation of healthcare professionals who are able to facilitate the psilocybin therapy. The simple answer is no, this is not something that needs to be written into the federal regulations. And this is up to the discretion of each healthcare professional sort of college, category of college. So, for colleges of social workers, if they agree that, social workers can then train in this modality, that'll be up to the individual colleges. So again, if anything needs to be disciplined within that, it's keeping it within those colleges as well.
Right. So every college or profession generally has a scope of practice. And now looking at psilocybin therapy, we can assume, or we're looking towards each college to decide, is facilitating psilocybin therapy in or out of our scope of practice? Can a social worker do this? Or would a social worker be a co-sitter or a lead therapist, et cetera? Same with registered nurses, physicians, et cetera. And just a follow-up question from Sarah, how can people access doctors who are registered? And I'm assuming you're asking registered in psychedelic psychotherapy. Is there a list somewhere? I'll pass it over to Spence.
Sorry, muted there. Yeah, absolutely. And that's what, again, it's the purpose of our training program, is to make sure that, what we're advocating for is that healthcare practitioners go through training. We've got a certain standard that we've set that I'll say is right now, it's complete, it's robust, it's a bit of a minimum too. And we hope that training and registration from here really picks up. I hope that universities and the colleges really accept this as education, and that they take what we're doing and really spin it into something that works well. But that's the reason we've got members who are going through training, is we call them TheraPsil, associates. And our hope is that one day when someone is able to get a medical document for psilocybin, that they're able to look through these associates and find folks who have gone through a training. If it's not spelled out in the regulations, at least they can find a group of people who have done training, who have hopefully taken psilocybin, or actually done the skills and didactic training to provide a safe journey.
Mm-hmm. One question I'd like to dive into a little bit, especially if there's some new folks on the call, is, we're talking a lot about doctors and therapists getting psilocybin for their own training. Why does a healthcare professional need access to the medicine in order to facilitate this for another person? Why is experiential learning so important in this modality?
Yeah, and I can take that one again. I mean, it was a really difficult couple of months last year, from August to December 1st of 2020 was the first time that we were able to get healthcare practitioners access to psilocybin. And it took a long time to get there. We had countless researchers, countless physicians, therapists, patients, all asking the Minister of Health for access. And using essentially the anecdotal information that we have from its cultural use, but also from the use in research, where many times in the research programs, they actually did phase 1 or the safety trials on the healthcare practitioners, who then went on to treat patients. So yes, it may not have been, researched that there was psilocybin being ingested for the purposes of training, but it's not like it didn't happen either, right? Everyone who was giving that therapy, or most of them, had taken psilocybin, and even those that maybe didn't on paper, I'm sure that they've tried psilocybin before. I hope that's not too audacious to say. And quite frankly, from the healthcare practitioners who have had the 19 of them, who have gotten the exemption, they've confirmed that it's incredibly important to build an amount of empathy for the patient. And of course, from the patients, who you ask them, who would you rather go to, the doctor who's had mushrooms or the one who hasn't? It's kind of a no-brainer. The one who's going to know what you're going through, who's tried them, who can tell you how much to take, what you're going to feel, and be able to speak about it with a bit of confidence and genuine understanding. So thankfully, that advocacy and the letters from doctors, therapists, nurses, and researchers was enough for the minister to change her mind, and it remains general best practices for all therapeutic modalities. If you're going to be a massage therapist, psychotherapist, providing cognitive behavioral therapy, or internal family systems, I mean, you're going to have that therapy done to you. You're going to be a participant before you ever become the therapist, that's for sure. And we assert that it's no different with psilocybin assisted psychotherapy.
Okay, thanks for that, Spencer. Just bopping back to the public consultation, what kind of frequently asked questions did we get, Julia? Is there any others that are coming to mind?
Yeah, just we've answered a few of them. There were questions about, because psilocybin is still a controlled substance, it hasn't got a DIN number associated like usual pharmaceutical drugs do, then wondering what was the system, if there were any sort of faulty, unsafe, or adverse effects for that product to kind of be removed. And this is all stipulated within the regulations as well, within the recall system. So if there were any of these things in place for a particular product from the license holder, then the obligation is on the license holder to recall that product within a 24-hour period as well. And then there was another couple of questions about the expiry of the medical document. Again, this is all stipulated by the healthcare professional who is writing it, and it has a maximum of 1 year anyway per medical document. There was another one saying, how do we ensure patients can access safe containers of healing along with the physical psilocybin product? For example, are healthcare professionals obligated to refer patients to therapists when they are prescribed psilocybin? I think we kind of covered this earlier. So no, this doesn't have to be in the medical document, but it can be stipulated. It can be saying where the patient is taking the psilocybin and how they're using it as well. And then finally, someone was interested to know how the 10 micrograms was decided on. It's written throughout the regulations. And on average, for a high dose trip, how many micrograms does a patient need to ingest? So 10 micrograms is equal to 1 gram of psilocybin mushrooms. And therefore, the average strengths of psilocybin mushrooms and the average box will not have more than 1 gram of psilocybin. So this is kind of like an intuitive way to relate back to the things that people use, such as the fruiting bodies. And this amount is unlikely to be an issue for anyone who took more than they wanted to. So for dosing, it is also reasonable around. So for example, there may be products that have like a 20 to 30 microgram that would equate to a high dose. And then there may be sort of 5 microgram tablets for the synthetic forms that could be manufactured for microdosing purposes as well. But we'll be sure to collect all of the frequently asked questions and consolidate them and have really clear answers for people, probably up on our website very soon.
Awesome. Thanks, Julia. I'm glad you mentioned microdosing, because I think that's also important. If almost all of the work that we do at TheraPsil is helping patients access psilocybin assisted psychotherapy, which you have your intention setting, your high dose psilocybin session, followed by integration sessions with a therapist. But obviously microdosing is a thing. And if patients, want access to that, doctors should be able to prescribe. And that doesn't mean a patient would then need to necessarily go see a therapist if they're taking, a sub-perceptual dose of psilocybin. So I'm glad the regulations also allow for that, both microdosing and macrodosing.
Mm-hmm.
So to kind of put a bow on this, what needs to happen for these regulations to get from the draft we have now to legislation? If we can answer that.
Yeah, I mean, all we need is to do again what we did last year, and that is to raise the voices of the Canadians, the patients, their family members, doctors, therapists, nurses, anyone who's concerned, the stakeholders, those of us who may want our neighbors, our family members, or friends to have access to this if they ever need it. To raise our voices and ask the Minister of Health and the Prime Minister to make regulations. These regulations could be adopted tomorrow. They really could. And we need compassion and a little bit of bravery, a little bit of courage. That's it.
Awesome.
We've also got a question in the Q&A.
Oh, I didn't see that. So sorry. See here. Okay, this question says, hi, I'm in the process of setting up my end-of-life doula business, so this treatment is very interesting to me. I'm wondering, how is knowledge of this treatment being made available to a palliative patient, as I assume this treatment is not widely known? Great question.
Thanks for the question, Tammy, and awesome setting up your own end-of-life doula business. That's great, and we specifically see a lot of people who would benefit from that. So thank you. How does this become available to a patient? I mean,
how do patients find out about it? If somebody's palliative, how are they going to know?
That's a good question. I mean, part of psilocybin being in the Canadian Drugs Controlled Substances Act is it's illegal to advertise. So there are a lot of issues. You can't call it a medicine. It's the problem with things being illegal is sometimes, one person's medicine could be another person's medicine, but you're not allowed to tell them that. And it does really put a limit on what you can say. So, this is a gray area, right? Are we advertising? I don't think so. We're not advertising, that psilocybin is a medicine, that it's going to work, that it's going to cure anything. What we're advertising is that Canadians all have the same Charter of Rights and Freedoms. And if they believe that something is their medicine, and if their doctor does, that they should have rights and access to it. And at some point, we may try and change the line on what is medicine. What is that considered? What is the advertising? So it's difficult to say exactly how a person finds out about it. Certainly telling stories or hearing other people's stories, hearing through word of mouth. That's what's been most successful for us. People like Thomas, the first gentleman who had been using cannabis, first started looking up, I believe he said it was mushrooms, for how to get, I think it was which mushrooms might help with the cancer that he had, thinking that it might be something like lion's mane or turkey tail, only to find out that, there are some mushrooms that may not work physically, but actually psychologically to help you. Which is quite profound if you think about it. That's an option, because he did find some mushrooms to help with his stomach, I believe, and also eventually found psilocybin. So it's a lot of self-discovery, and again, I think it's why when we say that we've got 1,000 patients that are asking for access to psilocybin, that's a very, very inaccurate number. I bet you there are multiples of that out there that maybe just haven't messaged us yet or don't even know about what it is, but with a bit of information might decide that that's beneficial to simply sticking with treatment options that aren't working.
Yeah, I'll add on to that. I mean, we're a very small organization, but we do our absolute best to put on these educational webinars. We do community presentations at Rotary clubs, for example. We have a pretty loud social media presence, and we also take good care to amplify the voices of patients and healthcare professionals who are on the front lines and really want to shout this from the rooftop. So There's a lot of mainstream media coverage nowadays, and I think that's a reason a lot of patients are reaching out and finding out about us. I can tell you on Saturday, CTV W5, they're going to have a full episode on psychedelic healing in Canada, and I bet you we're going to hear from a lot of people after that episode. So the more that people can talk about this and educate each other, bring this up at the dinner table, bring this up in your church groups, that's how the word gets spread. So public education, it's one of our pillars in our 4-pillar mission. And as a small organization, we do as best as we can, but we really need everybody to amplify this so that folks in palliative care or who have other mental health conditions who could benefit from this know this exists, know there's pathways to access this, and know that we are working towards regulatory change that hopefully in the future you don't have to go through this ridiculous Section 56 process. You can just go to your doctor. So with that said, I'm cognizant of time, and we did have a few pre-submitted questions. So the first question is, let's say I'm a patient, how can I get access to psilocybin therapy right now, today? Spencer.
Well, unfortunately, today you can't. It takes time, and that's what we're trying to fix. I think a reasonable thing would be, how would you get access to psilocybin therapy in a reasonable amount of time? Maybe 3 days. There'd be a regulatory mechanism to do so. You contact your doctor, and if your doctor thought that it would be right for you, in 3 days you'd have your medical documents for access to psilocybin. That's what we're fighting for. Unfortunately, I got to tell you, the truth is today, you may have to wait in the queue, and we're trying our best to triage, but it's difficult. And you might have to wait for, to find a healthcare practitioner in your area who's able to fill out the documents, and we'll work our butts off to make sure that you do that, but it'll take time. And then we've got to wait for the minister to grant an exemption, or the bureaucrat at Health Canada. Who that is, I don't know. But again, we'll work our butt off to make sure that you get a response as soon as possible, and that's what we're doing. So unfortunately, there's no way to get access to it today. The only way to do that is to break the law, and I don't advise against that. I don't think it's safe, and I think as a Canadian, I think anyone in this world deserves better than that. They deserve to be able to work with their healthcare practitioners who are willing and want to support them. But in short, let's look to the possibilities, to the future, and to what we should have in this country, which is medical regulations that give you access in as little as 3 days. If that's what you need, because for many people, that's exactly what they need.
Great, thanks, Spencer. Individuals are also wondering, how can they be a part of the potential charter challenge or the legal battle that's going on?
So I would say the best thing to do is to reach out to us directly. We've got info@TheraPsil.ca. Is there a better email to use, Holly, or is perhaps that the best one? I mean, if it's specifically regarding,
I will put my address in here, and I will forward to the right team member.
Perfect. Yeah. So if it's regarding a legal process, please email holly@TheraPsil.ca. I hope you don't get spammed with too many things, Holly, so please keep it to the legal. But we, like you said, we've got a legal challenge going right now. We've got a number of patients that want to join that, and the more the merrier. We realize that this is not going to just fizzle out, and we hope the government knows that. Is that how far are we willing to go? Just watch us. We're gonna go as far as we need to make sure that the patients are heard, that their rights are respected, and that they get the access that they need. So anyone else who wants to help out or get involved in the court cases is welcome to message us, because we've already got one going. We've already got the lawyers, and we've got other people who are going through the same thing. And I'll quickly just answer as well live here in the Q&A, because it's very similar. How can we get involved in helping the momentum? To Sarah, another great question. Please become a TheraPsil member. We are, a nonprofit society. And the best thing that we can do, and to put it into context, the way we started this organization, even before we were paid or before we really knew what we were doing, was putting together videos to the health minister and relentlessly letting her know that there are Canadians and there are patients, family members, friends that are in need of psilocybin. And I wish we had all the followers we had today. I wish we knew what we were doing and had the perfect message. We didn't, but it worked. It worked really well because we had a compassionate minister who heard this plea. So how can you help? Become a member, get involved, sign up for training. And please answer our calls to get more videos made and to reshare stuff. Is the way it works. And hopefully through that mechanism, through that channel, if there's anything more you want to do or any ideas you have, we're happy to hear them.
Awesome. Thanks, Spencer. I would just like to mention that, yes, if you're interested in getting involved, you can email me. I can give you detailed instructions on all the different things that you can do to get involved, or you can check out our homepage. It is pretty robust in terms of what we're doing, why we're doing it, and how you can get involved. The other thing I'd like to mention is our next webinar will be in 2 weeks. That is on November 3rd, also at 4 p.m. PST, 7 p.m. EST. And that topic will be psilocybin for palliative care. And we're going to be discussing particularly the topic of right to die, right to try. So, Canadians have the right to die in Canada right now through medical assistance in dying. Why do they not have the right to try a mushroom, which could help prevent that suffering that would cause them to move towards MAID? So that's just my call out. We'll see you in 2 weeks, and I'll pass it back to Julia and Spencer if you have any closing remarks at all.
No, only that. Look out on our website as well for regulations to be up there. We're working on draft 2, and we'll be putting together all the feedback and collecting any questions that you put forward today to make sure that we answer all of the feedback there. But share around the new regulations, give us your feedback, give us your thoughts. This is a process that we want everyone to be involved with. This is really helping the patients and the healthcare practitioners in Canada. So yeah, look out for that on our website as well.
Yeah, and maybe the last closing remark here, just because I haven't got to answer it yet, but I think Brian in the chat was saying from the San Francisco Psychedelic Society, Brian, send a message to Holly as well. You got her email address there, and if you ever want us to come chat at the San Francisco Psychedelic Society to do something similar to the Death Cafe webinar that you did, we're happy to. And that goes for anyone else who might be a part of or know of any large societies. Obviously we've got limited time, but if we can get big groups of people together, it's worth it. So yeah, other than that, thank you everyone. Thank you so much for coming and joining this. It's really amazing to be able to spread this message. And I just would really hope and ask that everyone here take the amazing videos that are being put together by different patients and healthcare practitioners and share it on social media, and share them yourselves and send them to all your friends, and tweet at the minister, tweet at the prime minister. Make sure this does not get swept under the rug. It's unfortunate, but it's the way things work. If they're not loud enough, you don't get heard. So we're trying as hard as we are, and we hope that you can help us out, certainly by showing up today. You did. So thank you so much. And everyone have a fantastic night.